Welcome back to the morning show on Arise News with me, Katia King. My first guest is a clinical radiation oncologist who's committed to improving the survival rates of cancer patients in Nigeria. Dr. Adedayo Josephs is a member of several international oncology associations and is constantly updating her vast database of cancer knowledge with frequent attendance of international cancer conferences, courses, and training days. As a founding board member and director of the Dorcas Cancer Foundation, which is a non-profit organization providing help to children with cancer in Nigeria, she's also a board member at and consultant at the Pediatric Center, which is the leading children's hospital in Nigeria. Today, Dr. Joseph will be educating us on child cancer and sharing with us all the information that we need to know about the condition. Good morning, Dr. Joseph. How are you?
I'm good, thank you. Thanks for having me.
Thank you for being on the show with us. Now, it is Child Cancer Awareness Month,
Yes,
so we thought that we'd dedicate this entire show to bringing the awareness of child cancer to our viewers.
That's excellent.
Thank you. Now, can you tell me exactly what an oncologist does?
An oncologist treats cancer, all kinds of cancer. There are different types of oncologists. So you have a medical oncologist who treats cancer using chemotherapy, which is medication. And then you have a radiation oncologist who treats cancer using radiation.
Right.
And then you have clinical oncologists who do both, which is radiation oncology and medical oncology.
Absolutely.
You can also have a surgical oncologist who treats cancer using surgery. So there are many different, there's pediatric oncologists who treat children with cancer.
So you are a general oncologist because you deal with
radiation. I'm a
radiation,
clinical oncologist.
Clinical and pediatric?
Clinical, so I do medical and radiation.
Wow,
Yes.
okay. And we also need to thank you for the work that you're doing because you are a pioneer of child cancer awareness in this country. You've created the Dorcas Cancer Foundation. Tell us a little bit about that.
Okay, well, Dorcas was a patient I met when I was doing my residency program in Lagos University Teaching Hospital.
Right.
She had osteosarcoma, which is cancer of the bone.
Wow.
And I got very close to her and her mother. And what I found that was special about them was that they had done the right things. She was ill and they had taken her to see a doctor.
Right.
But she had been to several doctors and it took ages for them to diagnose what was wrong.
Oh, why?
So that for me was really heartbreaking because they did what they were supposed to do. Usually we complain about patients that don't go to the hospital, but they did go to the hospital, you know, and Dorcas eventually passed away. And so I decided to do something to help. I mean, I found that I was always helping anyway, but I just wanted to be more organized about it and be able to reach more people with it.
Wow. And in terms of Child Cancer Awareness Month, why do you think that it is so important for us to start really becoming aware of the prevalence of child cancer in Africa?
Okay, so one of the things I found when I started helping people with children with cancer was half the time when you talk to people, they don't even know that children can have cancer. It always comes as a shock to them. And if you talk to most of the parents, the one thing they have in common is they had no idea that anything like that could happen to their child. You know, so awareness is very important. It's important for the public, but it's also important for healthcare professionals. You see, because the children will come to the hospital when they're ill, then the doctor who sees them is the one who needs to dig deeper.
Yes.
When a child is falling in all the time, has fevers that aren't explained, is losing weight, doesn't have an appetite, you need to think, okay, what else can be wrong here? What else is going on here? You know, so awareness is greatly important. You see, it's easier to treat something in stage 1 than in stage 4.
Absolutely.
You know, and childhood cancers have a very good prognosis when they're treated properly and they're treated early. Right. You know, you have survival rates as high as 80%, you know, when they're treated early. So, I mean, we can achieve that. And that's why we're working so hard. And
there are horrifying statistics of, I'll read this, for example, 100,000 children dying of child cancer every year, and 80% of those children live in
low yes, they live in low and middle income countries like Nigeria. Absolutely, that's perfectly accurate. And the truth about it is the data we have isn't even accurate because these data half the time, the hospital-based data. We don't even have community-based data, which is that so many children in the villages, in rural areas, who don't even get to see a doctor. They never get to the table of an oncologist. We don't have the data of those children. And those are the people that we're trying to reach. That's what we're trying to do here.
Wow. So in terms of cancer in and of itself, because a lot of people, like you say, there's not a lot of awareness around it, whether that be child cancer or adult cancer. Now, what is cancer?
That's a tough question. Okay, let me start with what is a tumor. A tumor is an abnormal growth. Okay. So the human cells grow and divide and die in a natural order that is well regulated, it's tightly regulated. However, when the regulatory processes become defective, you have growth that becomes out of control.
Okay.
So you have more cells than should have in that organ, and those cells are abnormal, they can't perform their function, and then they crowd out the cells that can perform their function. So that's what a tumor does. Now, with cancer, it goes one step further. It's what you call a malignant tumor.
Right.
And then it can spread, it can metastasize. So it can go to other organs and seed them and cause problems all over the body.
So when a person is, because you mentioned Dorcas who went to a doctor and was not, treated correctly, when a person experiences loss of appetite and fatigue and all of these symptoms that can be stigmatized towards cancer, what is it that you should be looking out for as a patient? And then what should you also be looking out for as a doctor? Okay,
so with the patients, it comes back to take your child to see a doctor, because that's half the time parents are treating their children at home by themselves. So take your child to see a doctor. But then what my message is, okay, so to the doctor, when the child comes, please look a little bit beyond the common things. So you treat a child for malaria once, and then you treat for asthma, and then you treat for infection, and then you treat for typhoid fever. It's time to begin to think, okay, something else is wrong here. What's going on here? And that's my message to the healthcare professionals is, let's have a high index of suspicion for these things so that we don't miss a diagnosis.
Why is it that, and this is slightly off subject, but why is it that every single time, or let me not generalize, but a lot of the times when you go to a hospital I'll speak for Lagos, you're generally treated for malaria first. You're given drugs for malaria, no matter what it is you have. Because in the case of Dorcas, she had cancer, and they're giving her malaria drugs. Why do we experience this? Why are there such high rates of this?
Okay, so let me just answer that question. The truth about it is that malaria is the most common illness that will bring a typical Nigerian to the hospital. So that's why the doctor treats for that first.
Right.
So it's sort of like, okay, let's get this out of the way. And then if you don't get better, let's look for what else can be wrong.
I see.
However, that's not to say it's best practice. The truth is, you should test, find out what's going on before you treat.
Absolutely.
Yes.
So in terms of the figures that we mentioned, the statistics, such as these 100,000 children dying every year of cancer, what is being done locally to reduce these numbers?
Okay, so there's a lot of work going on. There are a lot of foundations that are working on awareness and treating. So for instance, the Doctors Cancer Foundation, we focus on awareness, we focus on research, early detection, and treatment. We fund treatment directly. We provide consultations free of charge. We do a lot of work with that. I know the government is also working. They're trying to build more cancer centers, trying to get more radiation machines into the country and get them working. So there is work going on. It's certainly not enough. However, there are steps being made.
Okay. Now, I came across a very emotional post on your social media. Now, I'll read it just so I don't butcher the medical term. A 2-year-old baby called Favour who had rhabdomyosarcoma, and she'd been through 7 cycles of chemotherapy and right orbit extenuation, which is surgery to remove all the contents of the right eye socket. What happened?
Okay, so Favour is a little girl that I met. She actually isn't, we haven't been directly involved in her treatment. I just came across her randomly in clinic, and I became interested in her. She's such a cute little girl, very playful and very naughty. I mean, she took over my consulting table in 10 seconds of just interacting with her. Yes, and that's the thing with Favour is that this is the story of every cancer patient. I can tell you about Joshua, there's so many of them that we can talk about. This is the story. This is the real picture of childhood cancer in Nigeria. Children who go through all of these things. Now, the real pain here is that they're fighting against the odds. The odds aren't there to help them. They're against them. So what you find is she needs radiation, and there isn't any radiation machine working. So she's waiting for months to get on radiation. She's traveling from one end of the country to another to get on radiation. She needs chemotherapy. The drugs are stupendously expensive, and her parents can't afford it. Her family can't afford it. If they sell everything they own, they can't afford the treatment. So this is what happens here. And sometimes you tell the parents, okay, this is what you need, this is what you need. You write a prescription, you make a plan. They see the cost, and then they just take the child home. Because for them, it's unimaginable.
So that child's fate is sealed due to the fact that they've been priced out.
I've seen that countless times.
Oh, man. And how does this affect the children? I can imagine that it does something to them emotionally.
So you see, I say this all the time. One of the reasons why I'm so particular about children is because they're so dependent on the decisions that are made for them. They have almost no power over their situation. So you see, if the parents decide that they don't want treatment, they want to go to church, or they want to go to a traditional healer, the child isn't able to do anything about it. The child doesn't have any property to sell. He doesn't have any friends to reach out to ask for money. He can't apply for a loan from anywhere. So they're so vulnerable. And for me, that's the real pain here. These children are fighters. They're strong. They're stronger than adults. Children don't ever feel sorry for themselves. They don't ever say, why me? They don't ever break down. They don't ever give up. They just keep going. They don't know any alternative apart from them to keep going. But we don't help them. We're not helping them. The society is fighting against them as opposed to fighting with them. And that for me is very painful.
That is, I mean, I've got goosebumps listening to you because it's, you don't actually realize the temerity of what is going on, you know? Because, I mean, if you don't have cancer, you're never going to look for the statistics, are you? But
and I say all the time that a rare disease is only rare until it affects you.
Of course. And, you know, the thing is, a lot of people go through life thinking, well, it's never going to happen to me.
Absolutely.
Until it happens to you or someone close to you.
Absolutely.
Then you start scouring for information.
And you see, the reason we have to all work together is to make sure that when it does happen to someone who's connected to you, systems are in place to help that person. I don't want to wait until someone I love is ill to make sure that the hospital is working, to make sure that the doctors are going to pay attention, to make sure that what we need is available. I don't want to wait until that time. Absolutely. So we all have to work together.
You know, we're always told that people get cancer from poor diet or lifestyle choices such as smoking, etc. But in the case of Favour, we're seeing 2-year-olds with cancer. What is it that causes it exactly? I mean, it doesn't seem like there's any one thing. One day you're being told that licking the lids of yogurts can give you cancer. The next day you're being told that too much coffee can give you cancer.
Okay,
what causes cancer?
Okay, so this is my answer to that question. Everything causes cancer and nothing causes cancer.
Well, what do we do?
So the truth about it is, with adults, yes, lifestyle choices are super important. Right. Smoking, alcohol. In fact, now diet is the most important cause of cancer in adults. So yes, that's true, but that doesn't work for children. They haven't been exposed to the carcinogen long enough for it to really matter. With children, it's usually genetic aberrations, and those aberrations usually happen before or soon after birth. Really? And there's nothing anyone can do to prevent them, to know about. There's nothing anyone can do about it. It's absolutely not anybody's fault. Of course, as a parent, you should make the right choices. A pregnant mother shouldn't smoke, shouldn't drink, you know, should eat healthy and take good care of herself. But all of that has nothing to do. If you pick an average child who has cancer and you look into the history, it's nothing from the history that you can point out and say, oh, the mother did this, and that's why the child did. It's half the time, it's nothing like that.
So it's literally just luck of the draw sometimes?
Absolutely.
Wow. Most
of the time, 90% of the time. There are some children who are predisposed because they have a family history of cancer and they have a genetic condition that predisposes them. But that's less than 10% of cases.
Wow. Now, we're always talking, you always hear from doctors where they say early detection is the best cure, best form of prevention. So for those parents at home now who suspect that something a little bit worse than malaria might be affecting their child, what signs or symptoms can you look out for?
Okay, so if you have a child who's ill quite often, and this is very tough because children do fall ill. They pick up infections from school and all of that. However, you will know, what I found is a parent's instincts are super important. You will know that something else is going on here. Right. I'm a mother, and being a mother I'm really glad about it because it helps me understand some things. Yeah. So for instance, at some point when my daughter was ill a lot, I went to the hospital and I told the doctor, listen, this is what I want done. I want an X-ray. I want to know what's going on in her chest. I mean, I'm not okay to just take drugs and go home anymore. So I think that's what it is. At the point where you begin to think, I've been here 3 times in a month, either refer me to someone who's going to do something else or do something different from what you've done the first 2 times. Yeah. So that's what it is.
Okay, so in effect, what you're telling us is parents, caregivers, whoever you may be to that child, really just push. Yes. Ask further questions. Don't take no for an answer.
Exactly.
Amazing. And in regards to the Dorcas Cancer Foundation, tell me about some of the challenges and some of the success stories of running it. What have some of those stories been?
Okay, so the success stories are the children, truthfully, and it's the children we talk about, Inioluwa and Emmanuel and Samuel and Joshua. Those are the success stories. There have been heartbreaks. There have been devastating losses. You know, one of them was a little girl that we all fell in love with at Tinuke, and when she died, I think it was probably the most painful part of the journey for all of us. I mean, we had to take a break, sort of, and then come back and give each other a pep talk, like, okay, guys, we just have to go on. I mean, this isn't about us. But it really was. It really was.
Talking about this, I'm about to cry as well. Oh my goodness.
It really was devastating. Some of the challenges, I mean, there are a lot of challenges, but the truth about it is you can't do anything without funding. And it's hard to get people to believe in the foundation to fund it. I have to fight so hard to explain to people that, look, these children can survive. I always have to take the children with me. I want to show them Emmanuel. I want to show them his scans and say, listen, this is how he came. And this is him now. He's a survivor. He's cancer-free. This is possible. It can be achieved. And there's a lot of stigma associated with cancer.
Yeah.
There's a lot of people hear cancer and they just think, oh, it's death. And so half of the uphill climb is convincing people that, listen, survival can be achieved. You have an 80% survival rate. There's some cancers that if you look in the developed countries, they're not talking about survival anymore. If you pick a cancer like retinoblastoma, they're not talking about, they're worrying about if they can preserve vision in that eye.
Right.
Nobody here is talking about is the child, because it's taken for granted that the child will survive. But here, we're still struggling with survival.
Right.
So that's the real challenge is getting people to believe, is dispelling the myths and, you know, fighting the stigma. A lot of the reason why patients won't even go to a hospital sometimes is stigma. People don't even want to tell someone next to them. I keep getting asked if cancer is contagious. And for me, that's stunning at this point in the amount of, yes, with the amount of awareness and amount of, you know, noise that we're making. If people still think, oh, it's, parents will tell you that when their child has cancer, their neighbors tell the children to stay away from the child. Yeah, so he goes out to play and the other children run away from him. That happens a lot. So there is a lot of stigma. There is a lot of, fatality associated with cancer that we're trying to fight. And that's the real problem, is getting people to believe, you know.
So it sounds like we need to invest in education because there's a lot of...
In awareness. That's why, you know, people ask me, what's all the noise with awareness? Why does every NGO go on and on? Because the truth about it, everything starts with awareness. Change in policy starts with awareness. Change in society starts with awareness. Dispelling stigma starts with awareness. You know, if everybody is aware and people fear what they do not understand.
Yes.
And if they do understand it, then they won't be so afraid of it.
Absolutely.
And that's what it is.
Dr. Joseph, you are doing a phenomenal job. I cannot commend nor thank you enough. I would like for you to please, I am begging you on my knees, please give my viewers your social media handles, ways that they can contact the Dorcas Foundation, how they can support, how they can call you, email you, every single thing that we can do to assist.
Absolutely. I mean, we're on social media. Right now we have a social media challenge going on called Sing September.
Oh, amazing.
It's an awareness challenge and there are awesome prizes for people to win. There's a vacation on...
Oh, wow.
As one of those prizes, yes. Our social media handle is the Dorcas Cancer Foundation. We can be reached on phone, 0908-047-1209. The line is always open, and it's open to everybody, to people who want to help, to people who need help, who want counseling, who want financial assistance. The phone is open. Our website is tdcf.ng, and our email address is info@tdcf.ng.
Phenomenal stuff. Thank you so much, Dr. Joseph. I'm going to see you after the break because
awesome,
we're talking to one of your survivors. I'm so excited to see him. That is all from Dr. Joseph for now, as it's time for a short break on the morning show. Stay tuned, as when we return, I'll be hearing from little Joshua, a Wilms tumor survivor who'll share his impactful story with us. Don't go away.